Hello everyone, good afternoon. Sorry, last Saturday I was not able to come, no? Was not anticipated na madam na akong patient sa clinic because usually hindi naman ganun kadami na timing. So I was not able to come on time. So I decided just to resume my lecture today. Okay? So, good afternoon. So, last time I discussed to you about wound healing and fracture healing, no? So, hope you can remember a little of those concepts, no? So, this is the last part of my lecture about fracture healing. Last time, no? But I wasn't able to finish it, so I just continue, no? What are the factors that delays or that delay fracture healing, no? So there are also local and general factors. For the local factors that delay fracture healing, number one is still infection, no? As we all know, infected, no, it causes purulent pus formation and lysis of the soft tissue, the blood vessels, and the bone itself. No? It's very difficult to achieve fracture healing or bony union if you have an infected bone. But somehow, by nature, our body tends to adapt to infection, no? Even though the fracture site become infected, it still attempts to heal, no? Some of or most of my patients that had infected fracture site also heal, no? With adequate care and nutrition. Okay. So the second local factor is the insufficient vascularization at the fracture site, no? Because the trauma itself, no? The initial trauma and the subsequent surgery. So usually, pag ino-opera namin yung bone, pag dinadissect yung soft tissue, no? Oftentimes the periosteum is also being dissected, no? So remember, that one third of our bone blood supply comes from the periosteum. So that while doing surgery, we are also rendering somehow, no, the bone avascular or hypovascular. But we try to see to it that we just minimally dissect the soft tissue, okay? So that the blood vessels will not be disrupted, no? The third local factor is the insufficient mechanical stability of the fracture. Okay? So as I have mentioned during my earlier lectures, is that we need mechanical stability, no, in order for fracture to heal. So especially for direct bone healing or the primary bone healing. Okay, but if it's not sufficient, then it will lead to just fibrous non-union or the formation of your fibrous tissues. Okay, so there's no bone formation that will occur with an unstable fracture site. Okay, and the last one is radiation. So if you expose the fracture site to too much radiation, no, then it has an adverse effect on the fracture healing. Okay. So how about the general factors that delay fracture healing? Number one, and still we can see at the clinics, no, is the use of corticosteroids. Usually, these patients who are taking steroids, no, are also being treated for other concomitant medical problems. No? If you go back to your pharmacology, steroids, actually, most of them are life-saving, no? So life-saving yan, especially pag mga pulmonary problems, no? Life-saving yan. But on the other hand, it has adverse effect on fracture healing or even wound healing for that matter, no? So we clinicians should be more prudent in the use of our steroids, no? And also for the use of NSAIDs, no? The too much use of non-steroidal anti-inflammatory drugs, no? For pain control and inflammation control. Okay, it has also its own adverse effect on fracture healing. Okay, take note that based on the stages of wound or fracture healing, there's always the inflammatory phase, no? So if you inhibit the inflammatory phase, no, the other part of the cascades, no, of the cycle in the wound and fracture healing are being impeded or delayed also, no? Pag ini-inhibit mo palagi yung inflammatory phase. So we still need to be cautious also in the use of analgesics, no? So oftentimes, personally, I use centrally acting analgesics, no? Hindi na yung NSAIDs palagi. But this NSAIDs is an important armamentarium, no? For pain control and making your patients more comfortable while he is suffering from the effects of his or her injuries, no? So the second general factor is chemotherapy. No? So this is true for our tumor patients. So pag naka-chemotherapy yan, tapos we did resection of the tumor. So oftentimes they end up with wound dehiscence, no? Or sometimes necrosis of the wound edges, no? So it's very devastating for these patients, no? Having wound dehiscence because of the side effects of chemotherapy and also radiation therapy. Okay? And the last general factor that we should also consider that delay fracture healing is the smoking, no? For those patients who are heavy smokers, oftentimes they also have delayed fracture healing or even non-healing fracture or non-union. For us orthopedic surgeons, we define non-union as the absence of bone healing or callus formation in 4 to 6 months from the injury. No? 4 to 6 months. Different authors, no, medyo ano yan, hindi specific, kaya nga may range 4 months to 6 months. But on my own experience, if I appreciate no callus formation for my patients in just 3 months, no, usually hindi na talaga yan mag-progressive yung bone healing. So I'm very cautious about it. I need to do something, no, in order for fracture healing to push through. Okay? So may mga techniques kami na ginagawa as orthopedic surgeons, which I think you don't need to know as at this time unless you undergo residency training in orthopedic surgery. Okay? So may note dito, no? Osteoporosis does not have a profound negative effect on fracture healing. Kasi iba yan ang effect of osteoporosis. It may predispose the patient to fracture, no? Especially pag na-traumatized or due to accidents, no? But it was proven that there's no significant effect of osteoporosis in fracture healing. Kahit na osteoporotic pa yung pasyente, no, the bone still heals, no? But the bone quality is not comparable to the normal bone. Malambot pa rin, but it attempts to heal or it will heal. Okay? So, nasa true or false yan. Okay? So, now, going back to fracture, no? As I have mentioned, fracture and other trauma, no? Orthopedic trauma is our bread and butter, no? Our orthopedic surgery practice, no? So how do you define fracture? Yun ba yun? It's a break in the continuity of the bone, no? Actually, that's a layman's term, layman's definition. Sorry, fracture, no, or not for non-orthopedic specialists. So it's the simple definition of fracture. It's a break in the continuity of the bone. Okay. So on our point of view, iba yung definition namin. How do we look at the fracture? No. Okay. So, I think at this, at your level pala, your medical education, I think you should also know this definition, no? So that you can recognize the importance, the concomitant trauma that is being acquired by patients having fractures, especially for fractures secondary to high velocity injuries. Okay, mga falls or vehicular accidents. No? So how do we define fracture? So this definition was published or sinabi, no, ng isang prominent American orthopedic surgeon during the early 40s or during the Second World War, no? He was a pioneering American orthopedic surgeon, no? So he was Dr. Clay Morey, right? Americano. So he defined fracture as an injury to the soft tissue complicated by a break in the bone. So bakit ganon? Nauna yung soft tissue. Okay? So actually, it's easier to treat a fracture, no, with an intact soft tissue. Okay? Rather than a fracture having severe soft tissue injury. Okay, kaya palaging nauuna yung soft tissue. Kaya nga, it's an injury to the soft tissue, no? Just complicated by a break in the bone. If you not treat adequately or if you do not take good care of the surrounding soft tissue at the fracture site, then fracture healing will not push through. Okay? Hindi yan talaga mag-heal. No? The rationale for that is still physiology. No? Physiology being yung blood supply, no, and nutrition to the bone, no, which actually the soft tissue envelope provides, no. So yung mga blood vessels to the bone actually comes from the surrounding soft tissue. So that's why we take utmost care, no, in the surrounding soft tissue while treating the fracture, no? Okay, so remember that it's an injury to the soft tissue complicated by a break in the bone. Okay. So fracture is also classified as an open fracture or a closed fracture. As the term implies, no? For open fracture, there is a communication between the outside environment and the fractured bone, no? So we call that open fracture. Okay? While on the other hand, a closed fracture, the soft tissue or the skin at the fracture site is intact. Okay? So magkaiba yan, no? In terms of treatment, prognosis, and the outcome and functional outcome I need for the patient, no? So later on may pictures ako na you will appreciate what is an open fracture. Okay? And also fracture is also being categorized according to its anatomic location, or and second one, according to the direction of the fracture lines, and thirdly, whether it is linear or comminuted. No? According to its anatomic location, no? It can be described as proximal if it's, for example, the fracture is at your long bone or the femoral bone. Okay, so we usually describe it as proximal third of the femoral bone, or it could be at the distal third or the middle third of the femoral bone. It could also be described based on, for example, for the femur, no? If it's above the femoral condyle, we describe it as supracondylar femoral fracture. If it's below the lesser trochanter, we describe it as subtrochanteric. Okay? So, anatomic description yon. How about the direction of fracture line? Okay? So, we also describe fracture based on the direction of the fracture line as transverse, oblique if it is around 30 to 45 degrees from the long axis of the bone, no? Or if it is spiral. Spiral, parang circumferential yung yung orientation ng fracture line. Okay? And thirdly, whether it is linear, just simple linear fracture, or a comminuted fracture. Pag sinabing comminuted, may mga fragment or fragments, no? Multi-fragmented fracture. So, comminuted yun. Okay? So, it could also be described, yung fracture as pathologic, no? Or sinasabi namin pathologic fracture yan if the fracture site or fracture was due to a weakened bone caused by a pre-existing disease. For example, tumors, no? Nag-lysis yung bone, then subsequently it led to fracture. Okay? Sometimes there is osteum porosis, that's the pre-existing disease, no? Then nabali yung bone. So we call that pathologic fracture. But in clinical practice, most of these cases na pathologic fracture we see, no, are due to tumors, no, be it malignant or benign. Okay. So another type of fracture is the so-called stress fracture. Okay. So as the term implies, fracture was developed due to repetitive loading or repeated loading at that involved bone. An example of which is the fracture, the metatarsal bone of the foot due to running or sa mga trainees, sa soldiers or mga athletes, no? Na-fracture yung metatarsal, no? I had one patient who was a medical student before. He's already a doctor now, who had this stress fracture. I think that was the second, he sustained stress fracture of the second metatarsal due to sports activities. Okay? So, stress fracture yun. Sometimes, the cuboid bone of the foot, do you still remember the cuboid bone? One of the tarsal bones, no? Cuboid bone, isa sa mga pinaka commonly fractured bone sa foot due to stress, no? Stress related, repetitive loading, no? Running, lifting heavy weights, no? So yun ang fracture. Another type of fracture is your green stick fracture. I think some of you are already familiar with green stick fracture. Madalas yan marinig. Okay? So, what is green stick fracture? It's a fracture or failure on the tension side of the bone. Okay? If you look at your femur, or say for example your radius, no? Yung radius natin or for the long bones, no? Meron yang sinasabing tension side or the compression side. Okay? Usually pag meron yang curvature, okay? Especially for the femur and the radius, no? Doon sa convex side ng, say for example, our radius, it's called tension side of the radius. So, pag karoon ka ng green stick fracture, the fracture starts at the tension side. Sometimes, it's due to direct fall on outstretched hand. Okay? And this can only occur in children, no? Yung green stick fracture na to. So, it's one of the so-called incomplete fracture, no? So, because of the characteristic na plasticity of the bone in tinatawag na plasticity characteristic of the bone in children, no? So, this can occur, the green stick fracture. On the other hand, no, dun naman sa compression side na incomplete fracture, no, in contrast with the green stick fracture, may tinatawag tayong torus fracture. So it's a fracture or failure of the bone on the compression side. It can also be due to loading, no, or direct fall on the outstretched hand. Usually this green stick and torus fracture happens in the long bone of the forearm, the radius and the ulna. Okay? So parehas silang incomplete fracture. So the fracture is not circumferential. Okay? So dun lang sa specific side of the bone, whether be it at the tension side or at the compression side. So, what are the goals of fracture treatment? Okay. In general, no, madami yung goals of fracture treatment, no? First is to prevent infection. Siyempre, pag na-infect yan, hindi talaga yan mag-heal. Okay, or it's very difficult na mag-heal. And many orthopedic surgeons, no, especially during my training years, kahit yung mga bossing ko, sinasabi yan, pag mag-infect or magkaroon ng osteomyelitis, yung treat na fracture, no, they call it pain in the ass, no, kasi mahirap talaga to achieve fracture healing, no, but it can be done, diba? Okay, so it's one of the goals of fracture treatment, prevent infection. Second is restore soft tissues. As I have mentioned, we always pay utmost respect to the surrounding soft tissues of the fractured bone. Okay? Pag yung treating surgeon, no, hindi niya nire-respeto yung soft tissues, hindi yan siya orthopedic surgeon. Pag makita niyo na laslas lang ng laslas, hiwa ng hiwa, then he's not an orthopedic surgeon, no? Kasi he doesn't know what he's doing, no? So we take good care of the soft tissues because it's the integrity of the soft tissue is paramount for fracture treatment or healing. Third goal of fracture treatment is to achieve bone union. Okay? Pag hindi yan mag-unite yung fracture mo, then hindi yan magiging functional. Yung extremity na involved or yung pasyente mo hindi man lang hindi niya magawa yung activities of daily living. Okay? So, yun, maraming after effects pag we will not achieve union sa fracture healing, then maraming mangyayari sa pasyente na hindi maganda. Not only economically, no? Kasi magasto yan to achieve bone union, but also psychologically. Okay? So you need to consider those possible complications, no? Yung complications na yun, hindi lang yung physical meron ding mental, emotional, okay, na effects ng non-union fractures. Okay? Another goal of fracture treatment is to avoid malunion. No? So, for us orthopedic surgeons, meron kaming acceptable alignment na tinatawag. No? I think you don't need to know those specific acceptable criteria for adequate union, no? But there is the so-called malunion, no? Ibig sabihin, hindi talaga yun acceptable kasi malunited. Okay? So, pag malunited yan, ibig sabihin, say for example, the fracture is on your tibia and fibula. Pag malunited, sabihin natin, 20 degrees yung angulation, nag-heal siya pero 20 degrees angulated. So therefore, hindi niya magagamit ng maayos yung leg na yun ng patient. Okay, hindi siya makalakad normally. So maglilimp yan, no? And at the same time, yung magkakaroon siya ng uneven wear ng adjacent joints, no? Especially your knee and the ankle joint. Kasi malunited And ano yan, 5'3", 5'6", no? Yung paglakad niya. I think you can appreciate what I mean, no? 5'3", 5'6", ano yun talaga yan? So, wari-wari, timpang. Okay, kasi malunited. So, it's not nice to see and aesthetically, no, kawawa yung patient, no, pag nagtitimpang, especially pag lady or dalaga yung pasyente. Bahala na lang yung mga boys. Okay, okay. Another goal of fracture treatment is to institute early limb and joint motion, which is very important. If you will not be able to render the fractured bone stable, no, and you will not be able to treat the concomitant soft tissue problem, then you cannot institute early limb and joint motion. Okay? So how can you start early rehabilitation if you have an unstable fracture? Inadequate yung fixation mo, no? Ayun. I mean yung pag-fix, paglagay ng bakal and other hardwares, no, sa fracture site. Mali yung paglagay mo, mali yung approach, mali yung soft tissue dissection, then you cannot institute early limb and joint motion. So, knowing the principles and concepts of fracture treatment is very important in order to institute early limb and joint motion. It is not just in collaboration with the physiatrist, no, or the rehabilitation medicine, but basically it starts, no, sa orthopedic surgeon, no, how the orthopedic surgeon treated the fractured extremity. So what is the ultimate goal of fracture healing? No? The ultimate goal is to restore limb and joint function as early as possible. So, hindi mo pwedeng antayin ng 1 month before initiating rehabilitation or functional movement of the extremity. No? It's a failure on the treating orthopedic surgeon pag hindi yan magawa. Barring other complications, no, other medical complications for that matter. Okay, so yan talaga, so that the patient can be able to use the limb and joint, no, as early as possible. So mayroon din kaming classification of fracture, no, based on the mechanism of injury. Sa orthopedic world, no, very important sa amin in knowing what happened, no, yung mechanism of injury. What are the sequence of events that happen, no, na nag-cause ng fracture, no? Importante yan na concept sa amin. So that we can be able to anticipate kung anong, say for example, concomitant ligamentous injuries na mangyayari or other tissues na madadamage, no? Pag meron kaming nakita na specific mechanism of injury. Okay? So, and it's also very important for the classification and treatment, no, fracture, and how will you treat in terms of fixation, no? Anong klaseng bakal or hardware ang iyong nilalagay, no, based on the mechanism of injury. Okay? So according to the mechanism of injury, dalawa yan, no? First is caused by your direct trauma, no? Yung pangalawa is indirect trauma na nag-cause ng fracture. Okay? So under direct trauma, no, may yung first classification fracture, no, under direct trauma is your tapping fracture, no, tapping fracture. So this occurs when force applied, a typographical error. When a force is applied over a small area, okay, which result to a transverse type of fracture. So simple fracture, transverse fracture lang. And there is an associated little soft tissue damage, no? Maliit lang kasi small area lang yung in-applyan ng force, no? An example of this is a kick on the shin. Common ito sa mga soccer or football players, no? Natadyakan na kick yung shin bone or the tibia, no? So nagkaroon ng transverse fracture. Okay? So kasi doon lang sa area na yon where the force was applied, doon lang yung nagkaroon ng fracture. Or pag hinataw ng tubo, no, blows with nightstick, no, na attempt pag shield yung victim, no, hinataw ng stick or tubo, then nag-attempt siya mag-shield using his or her forearm, so usually na-fracture yung ulna. So it's also usually a transverse fracture. So that's a tapping fracture. No? So direct trauma yun. So I have here an X-ray, no? One of my patients, no? He sustained transverse fracture of the right femur due to vehicular accident. Tumama yung thigh niya sa isang hard object, no? When he fell down from his motorcycle. So it's a tapping fracture, okay, based on the mechanism of injury. Okay, so simple fracture siya, then wala masyadong associated soft tissue injury. So second one is crush fracture. So as the term implies, crushing, no? This is associated with extensive soft tissue damage kasi crushing na siya. Okay? And the fracture configuration is either comminuted or transverse. It can also be transverse. But the problem here is the soft tissue damage. Okay? And the fracture site is usually at the same level where the force was applied. In the forearm or at the leg. Okay? So crush fracture. So I have here an X-ray of one of my patients, no? So comminuted fracture siya. So vehicular accident din ito, no? Ang thigh niya hit din ng I think incoming na vehicle. Okay? So as you can see, you can appreciate yung mga fragments, no? Bony fragments. Okay? So, yeah, crush fracture, yeah. The third type of fracture caused by direct trauma is your penetrating fracture, so-called penetrating fracture, or mga missile injuries or gunshot injuries, no? Ngayon dumadami ito, no? Not only here in our province lately, but most of them from Samar, no? Personally, ang dami kong nakukuha na cases, no? Na mga gunshots, no? Okay? Mga missile injuries. No? So this type of fracture is produced by projectiles, no? In this case, mga gunshot. Okay? And gunshot is also classified based on its velocity of the projectile, no? So whether it is high velocity gunshot injury or low velocity. Usually, yung mga short firearm, mga ano yan, low velocity, no? However, pag mga long firearm na Armalite, M16, mga shotgun, no? Then it's high velocity. Kaya mas malaki yung damage. The enduring power of the gun or the projectiles, no, from the gun is dependent on the mass and the velocity of the bullet, no? Kung mas mabilis yung velocity, then mas malaki yung damage sa bullet. Pag mas malaki yung mass ng bullet, mas malaking bullet, so mas malaki din yung area na madadamage, no, sa tao. Tao yung natamaan. Okay? So, how do you define high velocity projectile, no? So, iba-ibang authors, no, mayroon silang definition. But for our purposes and for sa conventional high velocity gunshot injury, no? So, usually 2,500 feet per second yan, no? So, hindi na kami gumagamit ng mga 2,000 o 1,800 feet per second, no? Kasi iba-ibang authors eh. Pero for our end, 2,500 feet per second. So, yung kinetic energy na na-produce ng bullet, as I have mentioned earlier, no, is dependent on its mass and the velocity. So, the kinetic energy is defined as mass times the velocity squared over 2. So, yun ang formula. Okay? So, the greater is the velocity, mas malaki yung enduring power. Okay? So actually, mas importante yung velocity to cause more wound than the mass. No? Kasi pag in-increase mo yung velocity, exponential siya, times 2 kaagad. No? Exponential. So, therefore, mas importante yung velocity. Okay? So, kita ninyo, I have here also my patient who sustained gunshot injury. So, ano ito? Army, no? He was a soldier during that time, so high velocity injury ito. So, as you can see, multi-fragmentary, meron pang mga fragments ng metal, no? Yung from the slab, no? So, very severe ang ano nito, soft tissue injury din. So, kaya mas mahirap i-treat din. Okay, so this is an example. Can you appreciate that? So, high velocity gunshot injuries. Sundalo din ito from Samar, no? As you can see, this is yung nakikita ninyo, exit wound yan ng left thigh. Okay, exit wound yan. Yung entry wound, maliit lang yan from behind, no? Pero yung exit wound, talagang malaki. Tapos sumabog yung femoral condyles niya. Okay? Talagang multi-fragmentary yung femoral condyles. So, malas. Okay. So, the second type of fracture, according to the mechanism of injury, is the indirect trauma. Tapos na pala. Okay lang, I will end my lecture muna. 3 p.m. na. Okay? So I will continue tomorrow na lang. No? So I will try to finish my outline, no? Yung lecture outline in siguro 7 to 8 sessions lang. Including na yung demo. No? Okay? So, di ko na susundunan ko ang schedule ha kasi pero di ko na yung susundun kasi akong susunod na akong course outline. It doesn't matter kasi kung wala, tapos na ako ng course outline, wala, nakikita the lecture. Okay? Then, magkano pa kita eh? Mag-demohan, casting, basic casting. So, I need volunteer. Mga magpapasilin ko. Okay? Sino mo volunteer? Sige lang, sige balik ka volunteer.
Parang may neta.